am Dr. Ram Narayan. I'm a senior neurosurgeon based in Chennai, and I practice what's called restorative neurosurgery, that is trying to restore lost nervous functions by surgical methods. Today, I'll be talking about patients who have been in a coma state for many years and who can be probably brought back to conscious levels by surgical methods. As you all know, there are many instances like following bleeding into the brain, or sometimes some people who try to attempt hanging or swimming accidents or even road traffic accidents, and many situations patients go into a coma state and remain like that for many years. After 3 months, they develop end up in what is called as a persistent vegetative state. That is, they are alive, they are breathing, and all their basic functions like digestion, kidney function, all this happen, but they are not conscious. They may just be blinking eyes like this, but they may not be responding to any request. That is, suppose you ask them to lift their hand or anything, they won't listen, but they'll be opening their eyes intermittently, but this will be non-focused. They'll be blankly looking somewhere. This has happened to many people, and unfortunately there is a lot of difficulties with caring these type of patients, because they require continuous care of their bowel bladder, care of their back, care of their other body functions. It's a real challenging task for taking care of these patients also, and they are very prone to develop multiple infections, chest infection, urinary infection, bed sores, all these problems. Now, recently there have been some studies on which they have found that some surgeries and some medications can help patients with coma state to come back to normal life. However, the number of patients have been very less, the number of surgeries that have been done are very less, and probably that is why the select criteria have not been developed very well. As we develop better and better, I'm sure over a period of time we will be knowing which patients will benefit from the surgery. The medicines which are tried include a drug called baclofen, a drug called solpidem, and a drug called Coma. There are 1 or 2 patients of mine whom I have given just these medicines over a period of time, and they have been able to regain some amount of consciousness. That is, able to sit and take care of themselves and all that. But this doesn't work in all patients. So now there have been 2 surgeries which are developed. One is called intrathecal baclofen pump, and second is deep brain stimulation. In deep brain stimulation, the area of the brain called the thalamus can be stimulated to bring these patients back. There have been some cases in the world which have been operated and patients have become conscious. Intrathecal baclofen involves putting a pump under the skin of the abdomen and delivering the drug called baclofen into the spinal cord, which will take the drug to the brain, and people may regain consciousness. I have myself 3 patients in whom 2 have become conscious after the surgery, and also along with that I also use these 3 medicines which I meant, the baclofen, the solpidem, and the baclofen, solpidem, and Coma. So with these 3 medicines and with intrathecal baclofen pump, I have been able to bring back 2 patients back to normal out of 3 patients whom are operated. We are still developing criteria for which patients which will help, but there are some patients who will definitely do well after the surgery. Thank you.